Thanks. That's better.
Okay, thank you everybody for joining. For those of you who are joining now, this is our fun icebreaker question for the day. What superhero best embodies the spirit of your work and why? Feel free to put your responses on chat. You can come off mute if you want to talk about your inner superhero as we let everybody join the webinar. Thank you. Linda, I like the Wonder Woman and Hulk comparison. That is quite interesting. Hi, everyone. As you're checking in, welcome to today's Global Goods webinar, which is the second series of our new content, Global Goods. To just icebreak the whole webinar, we have a fun question for you on the screen. What superhero best embodies the spirit of your work and why? Feel free to put your responses on chat. Feel free to come off mute, talk about it. Thank you for joining the webinar. We'll give about the first 5 minutes for everybody to join and begin kicking off at 5 minutes past the hour. Wolverine, that's a good one. Welcome everyone to today's webinar. We have a fun question on the screen for you as we wait for everybody to check in and settle in. Feel free to put your messages in chat. Feel free to come off mute and let us know who your inner superhero is. I can see very, very interesting responses. Okay, feel free to continue putting in your superhero is. We'll start at 5 minutes past the hour. Sorry about that. Welcome everybody. As you're joining in, we have an icebreaker question for you on the screen. Feel free to put your responses on chat or come off mute if you want to talk about it. Welcome to our second series of the content Global Goods webinar. And today we'll be introducing two more of our new content Global Goods. But first, we'd really like to hear about your inner superhero. What superhero best embodies the space of your work and why? Okay. So feel free to continue putting in your responses, but I think we can begin the webinar today. So once again, thank you everybody for joining. Welcome to today's Global Goods webinar, where we'll be introducing two of our new content global goods. So just to start off this conversation, we'd want to take a short poll and ask, how would you rate your overall knowledge of global goods? You can just take a minute or two and just let us know if it's not much, quite a bit, or all about global goods. Again, for those of you who are just joining, welcome to our second series of Introduction to Content Global Goods webinar. And we just have a short poll question for you. How would you rate your overall knowledge of global goods? Is it not much, quite a bit, or all about global goods? We'd like to know before we jump into introducing you to two of our new content global goods. Okay, thank you for your responses on that. Most of you know quite a bit, about 11% know everything about global goods, and we have 20% to 6% who have marked as not much. So that is a very good group, a very good mix. So we will begin with, we'll start with an introduction to content global goods, part of our agenda. And then next, we've switched this agenda. So we'll first begin with Global Digital Health Monitor, which will be presented by Health Enabled, and then go into Digital Health Planning National Systems, which will be presented by TechChange alongside Merrick from USAID. And we'll have some time for question and answer between both presentations. So to begin with, I'll hand it over to Linda to take us through an introduction to content global goods. Over to you, Linda.
Thanks, Luciana, and welcome everyone. For those of you who are not that familiar with global goods, I just wanted to take a couple of minutes to give you a really quick summary about what they are and why they're important. So global goods are really health-focused digital public goods that are intended to be impactful, scalable, and adaptable to different contexts and different countries, particularly low and middle income countries. And they generally have the following characteristics. So first and foremost, they are available under an open license. And what that means is that they are freely available to access. You don't pay any sort of license fee for use, and you can take them and use these great assets and adapt them where needed to fit your particular use case. So they're very much focused on the health domain, and they're typically backed by a strong community with clear governance structures. They are funded by multiple sources and are either used at scale or have the ability to scale and have some demonstrated use and effectiveness. So really what we mean by that is that these are not brand new, untested innovations. These are relatively mature digital assets that can be used by anyone wanting to evaluate or try out or implement or adapt a particular global good. Content global goods are something that Digital Square has always supported, but we are particularly happy to actually introduce the 6 current global goods. We did do a very specific call last year to highlight content global goods with their unique characteristics, and they are categorized as a resource, a toolkit, or perhaps a data standard, something that is freely available and is used to improve the capabilities to manage health data. And that's quite broad, so it ranges from a whole bunch of different things. So as Luciana mentioned, this is number 2 in our series. Back in May, we introduced the first 2, which is the OpenHIE architecture framework, along with advocacy training for community health workers. And next month in July, we're going to be telling you about WHO Smart Guidelines and HL7 Fast Healthcare Interoperability Resources, better known as FHIR. And the other thing I just wanted to bring to your attention is our new Global Goods Guidebook, which we launched earlier this year. And this is an online resource where you can learn a whole lot more about the 36 software and the 6 content global goods that are available. So I will drop that in the chat for you to go and have a look at shortly. But at this point, I'm going to hand you back to Luciana, who's going to introduce our presenters for today. Thank you.
Thank you, Linda. Thank you for that succinct introduction to global goods. And if you want to learn more, you can always go to the guidebook and read more about all the other global goods that we have in there. So to begin our presentation, we will begin with, I'll introduce you to our esteemed speaker from Health Enabled, who is Patty Michelle. She is the CEO at Health Enabled. And a fun fact about Patty is that she is an award-winning children's book author. That personally for me, that is so exciting and one of the greatest fun facts I've read. Patty will be taking us through the Global Digital Health Monitor. So without further ado, I'll stop sharing my screen and allow you, Patty, to let us know more about yourself and take us through the Global Digital Health Monitor. Thank you. Over to you, Patty.
Great. Thanks, Luciana and Linda. And let me go ahead and share my screen. Why are you not? Okay. I'm working from a new computer, so I think my settings might need to be updated. Would you mind sharing? Actually, let me see if this works. Hold on a second.
I can share from my side if you're okay with that.
Is that okay?
Yeah, that's okay.
That'd be great. Thank you.
Okay.
Okay, so I'm really pleased to be here today to present on the Global Digital Health Monitor, which was just accepted as an informational knowledge global good. And before I begin on that, I just want to share a little bit about Health Enabled as an organization. If you go to the next slide. So a lot of the work that Health Enabled does is really around these sort of 4 areas, mobilizing leadership and really tackling new areas of interest and exploration in the digital health sphere, including areas such as response and prevention of sexual and gender-based violence through technology, equity, the digital determinants of health. We also work with large organizations and national governments to develop strategies. So have worked with PSI on their digital strategy and Gavi on their digital health information strategy, as well as with countries like Iraq, Egypt, Nigeria on their national strategies. And when we created Health Enabled around 10 years ago out of the mHealth Alliance, while we wanted to focus more deeply on issues and countries and organizations, we wanted one activity that could help raise the bar on the field. And at that time, we started exploring different options, whether it be awards or competitions. And the idea of an index emerged. And so we began sort of scoping out whether or not the field of digital health was ready for an index. And out of that came version 1, which was the Global Digital Health Index, which has since evolved into the Global Digital Health Monitor, which I'll be speaking about today. And then another body of work that we very actively engage in as an organization is really around measuring impact. And so we spend a lot of time conducting large-scale effectiveness studies of digital health interventions. If you go to the next slide. So the problem that the Global Digital Health Monitor was sort of, developed to address was really to help countries figure out where and how to invest limited digital health budgets for maximum impact. And so as different digital health interventions were starting to scale, one of the major challenges that countries were facing was really around sustainability. And it was in sort of identifying, some key enablers for sustainability for digital health that the Global Digital Health Monitor sort of came into being. The other challenge that we, co-created the Global Digital Health Monitor to address was to really help countries see where they stood in comparison to others. If you go to the next slide. So the monitor really strives to empower countries by providing visibility into where they are from a digital health maturity perspective. It also facilitates evaluation of the digital health ecosystem and really seeing sort of progress over time. And then it motivates countries to prioritize specific investments by looking for areas of relative, weakness in comparison to others. If you go to the next slide. So the Global Digital Health Monitor approach, it is an online platform. It is an open data platform. So all of the data that has been captured within the Global Digital Health Monitor is open, and the platform itself is open source. And it uses a core set of indicators to measure progress using the WHO ITU eHealth strategy framework, which a number of countries use to develop their national digital health strategies. And so, in effect, the monitor enables countries to measure their progress against their national digital health strategies. It also has been used by countries as an input into the strategy development process. It was developed through a participatory design approach with inputs from over 50 countries and 150 stakeholders. And it was designed with high, middle, and low income settings in mind to be a truly global platform. The Global Digital Health Monitor version 1 was launched at the World Health Assembly in 2018. And version 2 was launched at the World Health Assembly last year in 2023. And we paused the monitor from 2020 to 2022 due to the COVID-19 pandemic. And it underwent a very intensive review and redesign in anticipation of version 2. You go to the next slide. So the theory of change behind the monitor is that if countries are able to measure and monitor their progress, then they can identify sort of key gaps that support scale up and sustainability and invest in like the human and financial capital that is needed for digital health maturity, and that this would contribute to the enabling environment needed for countries to strengthen their health systems and achieve universal health coverage. If you go to the next slide. So the monitor was co-created with 4 sort of main use cases in mind. The first was to really benchmark a country on a spectrum of adoption of digital technologies for health. The second was to advocate for resources. So countries use the Global Digital Health Monitor to generate scorecards and use those scorecards within their countries to advocate for resources to key strategic areas where investment is needed. It also creates an avenue for countries to learn from each other. And so to facilitate peer-to-peer country learning. And then finally, it supports private sector entrepreneurs and investors to strategically prioritize new market entry and strategies. And it does this by sort of creating visibility into, potential enablers and or risks that private sector companies might face within a country. If you go to the next slide. So the Global Digital Health Monitor is comprised of 23 core indicators, and the indicators are grouped along the WHO ITU eHealth Strategy Toolkit, enabling environment components. And it has been redesigned actually in this last phase to align with the WHO global strategy on digital health and the prioritization of universal health coverage. It also addresses emerging technologies and broader digital transformation as a key enabler for digital health transformation. And it incorporates a new indicator around private sector, and it better measures diversity, equity, and inclusion and human rights in digital health. If you go to the next slide. So the Global Digital Health Monitor has been sort of endorsed by a number of global partners, and it is now in the process of being transitioned into the WHO as part of the Global Initiative for Digital Health. It is also being used by Gavi, the Vaccine Alliance, and the Global Fund to measure and monitor and prioritize their investments in digital health enablers. And it was used by the World Bank as part of their Digital and Health flagship report. If you go to the next slide. And so the Global Digital Health Monitor is comprised of a series of dashboards, a global dashboard that includes all countries and their digital health maturity. It has regional views that enable countries to look at where regions are based on the WHO regional classifications. And then it has country pages that enable countries to see where they are year on year, as well as to see where they stand in comparison to others. So it has that benchmarking function, as well as a nice spider diagram that sort of allows countries to compare themselves to the global digital health average or the regional average. And then it provides some of an overview description of the overall digital health situation within a country. If you go to the next slide. So last year, we were able to mobilize 67 countries to participate through a survey that takes, a country roughly, 2 hours to complete. We had 67 countries participate in the 2023 survey. And the results of this analysis have been presented in the State of Digital Health report in 2023. We are now in the process of mobilizing countries to participate for 2024. And so for countries that have already participated, they're able to review their 2023 submissions and then provide updates on that for 2024. And that enables them to see kind of where they are in comparison to where they were last year. If you go to the next slide. We were also able, through a collaboration with the Johns Hopkins Center for Global Digital Health Innovation, to pre-populate over 100 additional countries across 7 specific indicators where data was available through publicly available sources, mostly sources like the GSMA, as well as ITU and World Bank databases. And these are sort of proxies. They're not digital health indicators. They're mostly digital transformation indicators. But we were able to sort of compare the Hopkins sort of analyses against the Global Digital Health Monitor indicators for about 15 indicators, of which 7 there was sort of more of a one-to-one correlation. If you go to the next slide. And so I'll quickly walk through some of the highlights from the 2023 State of Digital Health report. And so across the 7 components, the component with the highest maturity is leadership and governance. And I'm, glad that this has been paired with the digital health leadership work, because I think a lot of those efforts have been sort of mutually reinforcing of the increase in maturity that we've seen across countries in terms of leadership and governance, which is at a phase 4. All other indicators are at a phase 3 on average, but you can see sort of the general variability across different indicator areas. And, the area that, and I'll talk a little bit about this in a minute, the area that, is the most challenged is the workforce. If you go to the next slide. So in terms of leadership and governance, the area that is probably the most challenged is governance. And what we saw was that in 2019, when we did the initial survey, that there were, higher governance, and then governance dropped during the pandemic. And so a lot of countries are actually struggling to reestablish their governance structures. There are also challenges in terms of emerging technologies. A lot of countries do not have, strategies for emerging technologies, particularly in the health sector, or strategies for emerging technologies that accommodate health and actually have a health specific focus. And then in terms of diversity, equity, and human rights, some countries account for this in their digital health strategies, others do not. If you go to the next slide. We also see, some challenges in terms of gender transformation and the lack of accounting for gender. And what we're also seeing here is that there's an increasing gender digital divide that is having sort of a negative effect on the ability of countries to really fully scale digital health interventions. What we are finding, though, is that health is increasingly being prioritized in national health strategies and policies, which is very positive. If you go to the next slide. In terms of strategy and investment, many countries have a national digital health strategy, but what we're finding is that public funding for digital health is sort of lagging a little bit behind. There was a wonderful study that was done by Digital Square that highlighted that countries with lower digital health maturity on average spend and or require significantly more money to scale and sustain digital health interventions. And so again, this sort of signals greater potential for an increasing digital health divide. If you go to the next slide. We added this sort of new indicator as countries are really struggling to make sure that they have effective engagement with the private sector. And what we're finding is that a lot of countries do not have visible participation of the private sector, or their participation is ad hoc and limited. And so this is sort of has been flagged as a major unmet need in most countries. And on a positive note, many countries are using universal health coverage as the cornerstone of their national digital health strategies, which very much aligns with the WHO global strategy on digital health. If you go to the next slide. In terms of legislation, policy, and compliance, this is an area that's sort of a mixed, kind of a mixed bag, where you have a lot of countries sort of at a phase 3. Countries have, sort of greater maturity in terms of their cybersecurity, which is often sort of taken up through broader digital transformation, standards development, and then weaker in terms of privacy or personal health data or personal data regulations in general. Many countries do not have protocols for regulating or certifying devices, and increasingly, as countries adopt more, digital health enabled either apps and or devices, this is going to become more and more critical. For cross-border data security and sharing, we've seen sort of two conflicting approaches to this in some regions and in some countries. There, because of the pandemic, we saw greater cross-border, policy and data sharing. In other settings, we saw the exact opposite, where countries became much more concerned about data sovereignty and where their data sat, and sort of disabled cross-border sharing. And then in terms of, devices and applications that leverage AI, we are seeing sort of another sort of major unmet need here. And some of the exploratory work of Health Enabled around evaluation and around thought leadership is sort of leaning into this space to really see kind of what can we do to set up almost like a learning approach to measure the health effects of AI within the digital health ecosystem. If you go to the next slide. In terms of the workforce, this is the area that has the lowest maturity globally. And so, in terms of pre-service digital health training and in-service digital health training, there's just not a lot that is happening. And so, again, really glad to be paired with the training and the learning folks here, because we just need a lot more systematic education at all levels of the health system. We also don't have sort of a clear career path within the public sector for digital health careers, and so you often have people within public sector that are working in digital health whose job descriptions do not match what they're actually doing. And so there's some really good work that's happening at WHO around competency frameworks, and with partners like ZimAm around developing sort of career paths for digital health. If you go to the next slide. And so in terms of standards and interoperability, architectures tend to be a little bit less mature, and standards are a little bit higher maturity. And so countries have, adopted, standards more effectively, architectures less so. And, was really happy to hear that in last month's Global Goods webinar, you had HIE and OpenHIE and their architecture framework. And that in the next one, you'll have the FHIR standard, which I think will be really good and maybe help contribute to some of the discussion around this. If you go to the next slide. And so infrastructure, a lot of this, the work around infrastructure and the big push by WHO through GUIDE around, global public infrastructure really goes into the need for the underlying, infrastructure ecosystem to be in place for digital health to really scale and and be sustainable. We also identified sort of one particular area of interest based on some work by the Johns Hopkins Center for Global Digital Health Innovation, that there is a strong correlation between digital transformation maturity and primary healthcare outcomes, with significant linkages to mobile phone ownership by women, which then goes back to what we were talking about earlier around the gender digital divide. If you go to the next slide. And so last but not least, in terms of services and applications, what we have found is that there's a bit of a misalignment between the digital health interventions that countries are prioritizing and their health priorities. And I think there's a greater need to make sure that like what countries are doing in terms of digital health is very much aligned and sort of an enabler for a broader prioritization within their health sector. We saw sort of a mix of countries with some of the underlying registries that are needed for global digital health maturity. And so, a need to focus on some of these areas. And I think it came out of the pandemic, but many countries are using digital health for population health management, which is a really promising indicator for how countries are starting to leverage the data from digital health for planning and prioritization purposes. If you go to the next slide. And then again, sort of these sort of major registry areas are, lagging a little bit behind other, digital health investment areas, and really just encourage countries to prioritize some of these things in alignment with what's happening with the WHO Global Initiative for Digital Health push around digital public infrastructure as a global good. If you go to the next slide. So we did a quick comparison between the 2019 and the 2023 surveys, and found that overall countries are progressing and increasing in their digital health maturity. Some regressed during the pandemic. They were quite high and they kind of declined. One indicator that we have seen across the board is that countries that did have higher digital health maturity were much more resilient during the pandemic. And so again, another important reason to invest in digital health enablers. If you go to the next slide. So finally, just want to thank some of our early adopter countries for 2024 for participating, and just provide this sort of call to action. We are really pushing to get to 100 countries in 2024. So please do engage with us. And apologies, I reused parts of this deck for my presentation at Global Digital Health Day last week. And so we are not going to a fireside chat with Derek Munene, but turn it over to our colleagues at Digital Square to introduce the next presenters.
Thank you. Thank you so much for that presentation, Patty. Thank you for that deep dive into the Global Digital Health Monitor. A lot of lessons to be learned. For people on the call, we'll be able to share this with you. So now I'll open it up to any questions. Feel free to come off mute or put your question in chat. Linda, I think I saw your hand up.
Yeah, hi, Luciana. Thank you so much, Patty. That was really interesting, and a wealth of information that you just provided to us. One of the things I was wondering in terms of, maybe could you elaborate a little bit more on the data standards and the interoperability indicators? And what were some of the findings there in terms of the actual uptake of things like HL7 fire and other standards?
Sure. So, I mean, I think for a lot of countries, they, I think they're much more advanced in their standards, adoption. I think it is easier for countries to start with standards and the adoption of standards than it is to adopt and then implement an architecture. I think architectures are just much more complicated. And what we're finding is that countries can go sort of like one of two routes. They can either go adopt a national architecture that is more of a digital transformation architecture, sort of the Estonia model, where then there's adaptations and linkages into the health system, or they can adopt a specific health, architecture, as in the case of Open HIE, or some sort of combination of the two, where they have sort of a mix of like Open HIE and linkages to like a broader national architecture.
Thank you.
Thank you very much for this presentation. I want to ask one question in terms of standard and interoperability indicator, which has been looking in comparison of these countries.
Sorry, I didn't catch the question.
So what are the indicators being considered in terms of standard and interoperability?
So there's a lot of standards. So there's like, having worked on national digital health strategies and policies, there are a number of ISO standards. So the International Standards Organization has a whole set of standards that countries, have adopted. There are ITU WHO standards that countries have looked at. But offline, I would be very happy to put you in touch with my colleague at Health Enabled, Emeka Chukwu, who this is, what he, does and lives for. And he can send you like entire lists of, standards that countries have, have adopted, and the order in which, it's recommended that they adopt them, because some are, much easier to adopt and others just take a lot, longer to socialize.
Yeah, thank you. It is interesting. I think I hear you mentioning Estonia, India for this standard and interoperability have been making it wonderful in this one. So I'm very interested to see how they do in that area.
Yep.
Okay, thank you. Thank you for that. Feel free to continue putting your questions in chat. To move on, we will go to the next part of our presentation, which is around the Digital Health National Planning Systems. So just to introduce you to our speakers for the day, we have Ariel Frankel, who's a Senior Director of Public Health and Education at TechChange. And a fun fact about Ariel is that she loves climbing, playing piano in her free time, and has never lost a hula hoop competition. I don't know, I might take you up on that, Ariel. And alongside her, we have Merrick, who is the director of the Center of Innovation and Impact in USAID's Global Health Bureau. So they'll be taking us through digital health planning, national systems, and without further ado, I'll stop sharing my screen and hand it over to you. Over to you, Ariel. Thank you.
Perfect. Thank you so much. It's really nice to see everybody here. I'm going to share my screen, and Merrick and I are going to co-present this together, because you will see how much developing this specific course, which has now since become a Content Global Good, is truly a partnership adventure, and it's taken several years to get to this point. All right, so we'll dive right in. We nearly already did these introductions, so I'm going to just move right on through. And while you all might know a bit about USAID, you might not really know about who and what TechChange is. So very briefly, just to let you know that TechChange leverages our tech platform and our instructional design and facilitation skills to build highly interactive and engaging courses for our partners who all work in the social impact space. And one of our largest focal areas is within the space of public health. That's what really I focus on at the company with my team. And specifically, the digital health program that we will discuss today is one of our largest courses that we work to help steward on behalf of a large group of partners and networks in the digital health space. So I'm going to pass it on to Merrick to give you a bit of a background on how we even got and arrived to the state of building a course on digital health planning national systems.
All right, thanks, Ariel. So a brief history of digital health planning national systems. I think you could see from Patty's presentation before that there's a wide variety of levels of maturity that countries are at. But one of the more consistent things we see across countries is there's a tremendous amount of digital health systems in most countries, like typically over 100 that the national governments are trying to track and coordinate and organize. And one of our sort of larger theories of change in the digital health space is that that governments have difficulty coordinating this. We hear this from ministries all the time, and that the fact that donors such as USAID, as well as many of our other partner donors, are consistently funding a lot of siloed vertical systems that focus on program outputs as opposed to the sort of the health system needs overall, and that this leads to suboptimal outcomes. So, next slide. One of our big beliefs in how to actually change the paradigm was to empower the governments of the countries that we work with to better articulate plans for coordinating their efforts. So things like the monitor is a really great aspect, and we actually point to it a tremendous amount during the course as a common tool that governments can use to sort of organize their understanding of their strengths and their weaknesses. But we really believe that the actual leadership team in the country is critical as well. And so we wanted to develop a course targeting that specific group of national planners. These are mostly people that we aim that are within the government, but sometimes they are supporting organizations like UNICEF's and WHO's and others. So this was a project we did with WHO and a whole variety of other partners. Gates, McGovern, Last Mile Health are a few of the significant ones. UNICEF, another one, that really identified this need and worked towards developing a comprehensive course that wove together all of the best thinking around how you actually plan from a national perspective at a systems level, like a health systems level, for digital health. And that resulted in a course that initially was a course meant to be delivered live, and then COVID happened, and we pivoted and switched to a virtual modality. And then recently, we've delivered it live again, actually in Cairo, Egypt, recently. But that is the course, Digital Health Planning National Systems. It just got its global good status.
Great. And I'll jump in right here to share you a little bit about, so then what is this course? What does it even look like? So as Merrick had already alluded to, we have our target audiences that really focus on addressing that gap and that challenge that was mentioned earlier. So we really try to target as much as possible the leadership within the government and also mid-level ministry officials as well, those doing the actual work there and those in their networks. Our secondary target audiences are other national planners of and investors or implementers in global digital health systems. So this might look like other funders or multilateral organizations like UNICEF, the WHO themselves. And some of the implementing partners even as well have taken this course and gotten a lot out of it, especially if they work closely at a national scale. So that is a little bit about our target audience. And our course objectives, I won't go through them all here right now for you, but in general, they range from providing new skills and filling in gaps related to national planning for digital health, to learning new methods and skills to apply in their work, and also strengthening their own leadership and management skills, confidence to actually go ahead and execute on some of these things, but ultimately to advocate for a whole different shift in how they might see planning for digital health with what we call an enterprise approach, thinking about the system as a whole, as opposed to those fragmented siloed approaches that Merrick mentioned earlier as part of the challenge and the problem. The course itself is built across these 10 core modules. We have an introduction that really sets the foundational understanding of what we will be talking. And a big part of what we did to even develop this course was looking at the whole range of WHO and other digital health toolkits, frameworks, methods that are out there, developing a standardized terminology and language to set the baseline foundation for everybody in the room to speak and talk the same language. We talk a lot about interoperability as it relates to technical things, but we also need to talk about it related to people, and coming with the same vocabulary is a huge part of getting there, and a big and important part of our course in setting the capacity of these leaders to lead with the same language. And then, of course, the primary focus is on the national digital health planning process, which ranges from everything from really coming up with that national digital health strategy all the way to costing and procurement and governance and et cetera. And I know that Patty talked a lot about the leadership and governance component being an area where we're seeing some levels of maturity increase. And we hope that this course is a contributing factor to a bit of that, growth. Just to give you a sense about what the course is structured like as well. So what do these materials even look like? How are they shared with our participants? Well, we've really structured this course to be about 50-50 in terms of lecture-based and activity-based. And that's because while it is really important to learn new knowledge, this course was trying to achieve objectives that were much greater than that. They were trying to achieve actual skills and techniques. And to do that, you really need to get your hands a little dirty and start working in activities. So that is also why we did that. And we wanted people to learn in groups with other peers, because adult learners are very strong and capable, and they bring a lot of intelligent experiences to the table. It's not a one-way street where a subject matter expert will teach you. We can also learn a lot from our fellow participants. Another important aspect of this course is the use of a fictional case study that we developed over a period of many iterations to service many different contexts. And this case study is intended to help bridge the different concepts in the course and help our learners practice and apply their skills in the activities with this case study in a safe and comfortable environment, such that they really have simplified it so they can really learn the concepts before they go and adapt it for more complex environments like their own country contexts. A big part of the course adaptation process is that people can adapt these case studies if they would like for themselves, but ideally, this was specifically built with a storyline that can work in many contexts, and we've trained now in many different countries, over 90, and it has worked quite well on training on those topics. But at the point in time where participants are able to then apply their learnings to their own context, we also in our course, at the way end, after learning it, practicing it in groups, leveraging the fictional case study for that practice, we actually ask them to look at their own country, their own context, and deliver a final project presentation, applying some of the concepts and skills that we learned throughout the course there. And here's a little example from there, and you can actually see that this is in more than one language, and I'll go into that in a bit. Our course is available in 4 different languages. I won't spend too much time on this slide getting into the nitty-gritty that you see here, but just to give you a sense, this course is offered primarily right now in 2 different facilitated formats. One is synchronous and one is blended. The synchronous format is how we began this journey, and the learning happens live, like you and I are on this call right now, and I'm presenting a slide deck, and the group activities happen live as well. This is quite time intensive, but we have found that it has been a great method for learning. In order to reach greater scale and also to be able to meet a lot of our participants who have very busy and challenging schedules, we've also created a blended version which combines self-paced learning with this live activity learning. So the delivery of the presentations is learned in a self-paced manner. They're reading through content on our platform and interacting with it in exciting ways with quiz features and other interactions, but then coming together live for the activities with their groups. As I mentioned, all the different formats I mentioned previously are all available in these 4 languages, and we even have a facilitation team from the countries in which we target in these languages themselves who have been trained up to deliver them as well. And that is also an objective of ours in order to really be able to meet what it really means to be a content global good, is that we don't want to be centered in just English, and we wanted to really cater it to as many audiences as possible. So as I said, this course, when we developed it, we created it with a Creative Commons licensing such that all materials are open source and available for anybody to use. And this has really helped set the stage for us to really become this global good for health. And maybe an exciting piece about this, in order to really live true to the value of what it means to be a global good, and to make sure that these files and materials are as accessible as possible. What you see here is a snapshot of a file spreadsheet that we have created that is also freely and available for anybody to leverage and use. And it has the collection of all the files that you will see in this course, every single file in every single language. We also track whether the language files are as up to date as our English files, or whether there are some updates in progress. So we keep a tracking mechanism in there as well. We do also have a list of course standards that we ask people to review, to just understand and have some considerations to make before you go and adapt the course. A lot of the things that we did to establish the baseline and foundational materials here was really intentional. So we want people to understand that before they adapt it, but you're really welcome to go for it. And to just give you a sense of how many adaptations have happened since we've made this available for anyone to use with Creative Commons, there are 5 known adaptations that are at a pretty large scale that are delivering right now or have already. Here are just a list of some of those places where they've been delivered. And as long as the course citation is used, you're welcome to use those materials, adapt them, use them in however way you would like. And I know that we're getting close on time here, so maybe I'll just go right into and let you know that we also have a training of trainers program that has also helped facilitate the additional spread and the value behind the global good. And people use those, get trained on how to use that knowledge repository of files to be able to adapt the course. I don't know how we're doing on time, if we want to wait and get some questions here at the end. We do have slides that go through the course stats and the impact, but maybe Luciana, would you like us to just pause here and leave space for questions, and we can give these slide decks to people if they want to review it on their own?
I think that would be perfect.
Great.
So we're open to questions. Anyone feel to come off mute or put your question on the chat? We'll share these materials with you.
Well, while people like the rest of the deck, it probably went on for another 15 minutes, so we definitely weren't even close. But it went through the monitoring and evaluation we did, which was a blend of sort of constant monitoring that happened during the course with pre-course surveys and post-course surveys. But we also did quite a bit of follow-up work looking at what people did 6 months after the course from a qualitative frame, and published a set of case studies to try to validate whether or not what we were doing was actually having the impact that we were hoping for, and it did. You can look at the deck to see the rest of it, but we found that everyone we engaged with post course, which was a blend of the first few trainings that we did, 6 months post course, were able to apply the concepts in their jobs. So like in their day-to-day work, they were actively applying the concepts, as well as being able to remember and understand them. And then we found a few people who had really taken it up the next level and expanded beyond just using the course materials to do things like teach or design new programs with it. People were weaving it into their presentations and like changing their architectures for their countries. So it was like really fascinating to see the sort of things people were translating it like into Mongolian, for instance. That was really fascinating, and using it as part of the medical exam continuous learning points for the country of Mongolia. It's really, really interesting, the work we found. I wish we had more time to go through it, but we will share the deck out and you can look through what we found.
Yeah, I just shared it in the chat, so you should be able to see it. It's view permissions for anybody.
Thank you both for the presentation. Sorry it was cut short due to time. We might have another chance for this one day. But thank you all for coming into today's webinar. I hope it was valuable for all of you. Thank you to the presenters for taking some time to share with the rest of us in digital health. And our next webinar will be on the 7th of July, and we'll give you more info on that. We'll be able to share with you the decks, the recording of this webinar, and yeah, and give you a platform for any other questions you may have. Otherwise, I think we're at time. Have a great rest of your day, and thank you all again.
Thank you.
Thank you, everyone. Thanks. Take good care.